What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. Hey, welcome back to Beyond the Scripts. I'm your host, Will Tuft from the PioneerRx education team. Now, every time we have a guest on the podcast, it seems like we talk so much about the collaboration between that pharmacy and their community, that pharmacy and local networks, and really how many of the leaders in pharmacy today are just really moving the profession forward. So today we have a very special guest from the state of Ohio. We have Miss Alison Haas. Alison, thanks for joining us.
You bet. Thanks for having me.
So you are a pharmacy owner there in the state of Ohio, as well as a big player in the CPESN team there as the lead luminary and lead network facilitator. So tell me a little bit about what that looks like just on the day-to-day for you.
Sure. So I'm really lucky. We have a great team of luminaries in Ohio. And, lots of folks that help play a part, but Kevin Day and I co-lead the network in Ohio. So our team meets weekly to kind of strategize and work through payer engagements and recruitment and those sorts of things. So we have a lot going on in Ohio right now. So it's definitely a bit of a time commitment, but very worthwhile to see things kind of moving forward and, getting to be a part of that and working with about 100 pharmacies across the state of Ohio right now.
Awesome. And so you're doing that at the same time that you're actually serving in your own pharmacy. Are you in the pharmacy every day, or do you have a bench pharmacist who kind of fills in?
Yeah, I have an awesome staff. So I have a part-time pharmacist who's there a lot of the times. I kind of pop in and out a lot, but do still staff. And then we also have a resident who is there 2 days a week with me, and then they split their time with Ohio Northern University, and then 1 day a week with CPESN Ohio. So that's been a really nice addition to our pharmacy.
Very cool. So where's your pharmacy at exactly?
We are in Jackson Center, Ohio. And so our claim to fame here in Jackson Center is it's where Airstream travel trailers are made. So,
oh, nice.
Yeah. Silver bullet travel trailers, but we're just about 45 minutes to an hour north of Dayton.
Okay, very cool. Yeah, that's one of the things on my bucket list of projects is one of the cool old Airstreams. They're just such a cool piece of Americana and Wanderlust and retro style. It's just a cool thing. So that's kind of a neat tie.
Yeah.
So you guys opened this pharmacy not too long ago, right? 2014. Was that a completely new startup, or was that a pharmacy that you guys took over? How did that come about?
It actually was a completely new startup. So there was a pharmacy here in town for I think about 20 years, husband and wife. And so timing wise, we just happened to still be in school when they closed the pharmacy. And our intention was to buy a pharmacy in the general area and not necessarily pursue the startup as our first venture out of school. But we couldn't find something that exactly fit our needs. And we knew we wanted to get back to Jackson Center eventually. We were just hoping to get a little bit more experience under our belt before jumping into a startup. But we just went ahead with it anyway. And so my husband and I started the pharmacy in 2014. And oddly enough, it's in half of the location where the old pharmacy was. And then we shared the building with Subway. So it's super convenient lunch. And you can we have our own entrance to Subway. So.
Oh, nice.
Right?
So that's kind of neat. So you guys were in pharmacy school together, or is he in the pharmacy as well?
So he does not currently work in the pharmacy. When we first opened, he actually was there every day for the first year, while I spent time at Cal Pharmacy. And then we did the transition. Actually, for a while there, we were both, working a couple jobs to make it all work in the beginning. And then I took over full time in year 2 or 3. But he's very helpful as far as operations and, advice and whatnot, but he's not there all the time.
Nice. All right. Well, shout out to Brandon for helping get that going. Also, you mentioned Calp Pharmacy, kind of a mainstay in Ohio pharmacy. So shout out to Calp as well. Tell me a little bit about that. So you guys decided, hey, let's go start a new pharmacy. The existing pharmacy was already closed. How did that transition kind of happen? Because there seems like there's a gap. Did those patients go somewhere else, or was it a pretty smooth transition?
It was a little bit hard at first. So it was actually probably about 5 years between the two stores. And so we're in a small town of about 1,500 people, and we don't currently have a grocery store. So I think, traffic patterns and folks having to leave town to get groceries and whatnot, they got kind of used to getting their prescriptions elsewhere. So it did take a little bit of time to get that habit back. But we're very lucky. We have a lot of providers in town. So we have 2 physicians' offices that have multiple providers. I mentioned Airstream earlier. They actually have a provider on site as well. So for a small town, we have a lot going on in the healthcare world. So it did take us a little bit of time, but the providers were all super supportive and did a really great job of, making sure that folks knew that there was something in town. And a couple years in, we really kind of got to a point where we were able to level off and have been going strong since.
Nice. That's kind of interesting. How far of a drive do you think your patients had to make before you filled in that gap?
15, 20 minutes is probably what most of them were making to get to the nearby bigger towns.
Yeah, so that's relatable. I mean, that's something we see a lot of in this area is that you have some major hubs, but you have a lot of those small communities. And, a lot of times it's like, all right, we're going to, it's time to go to town. We need to go get groceries or whatever. So any of those outings you really have to plan for. And medications, that can be something that might be put off then until we can, group those trips together. So,
especially if you're, at the doctor in town and you had to leave and go elsewhere to get your prescription is super inconvenient and, not great for healthcare. So we're glad to be here and be able to fill that hole.
Yeah. So were there any was there a lot of fear or nervousness opening that pharmacy where another had closed? Did you see that, hey, counting rooftops, looking at demographics, there's opportunity here? Or were you ever second guessing that decision based on the fact that another pharmacy had closed its doors?
Yeah, I mean, I think you always second guess, right? I mean, anytime, especially with a startup pharmacy. But, we would have people come in initially and say things like, well, just kind of want to see if you make it till we transfer our prescriptions. Just don't want to go through that hassle. So that was hard to hear, especially a year in, still hearing that, we're never going to make it if you don't transfer your prescriptions. But the overwhelming majority of people is really supportive. So, I mean, we still run into problems with big employers that a lot of our, would-be patients or just more our acute care patients are only acute care patients because their insurance pushes them elsewhere. And that's still a big struggle for us. And, we could do a lot more for a lot of people if we didn't have those barriers of, mail order and, the big chains pushing folks. But, for where we are, we're doing all right.
Yeah, for sure. That's something we've talked about with some of our other guests too, is, a lot of times people in your community don't know that those local options are available and even, don't know that their prescription drug coverage may have some of those opportunities if they were to explore that a little bit. So if somebody were looking to open a pharmacy, based on your experience and with opening that pharmacy, but also all of your experience with CPESN and the current landscape, do you have any advice you'd give to that entrepreneur right now?
Oh, so much advice. Could fill the whole hour with it. No, really, I think that it's a hard place we're in right now because we're still kind of living off that dispensing revenue, even though it's not great. and really looking forward to the future of what, the service-based reimbursement looks like, and, getting paid for all these great things that we're doing in our collaboration with the rest of the healthcare team. So, I think right now you just have to position yourself in a way that, you start with that appointment-based model from the get-go and really train your patients, that your pharmacy is different. I think the general population, sees pharmacy as all the same, no matter where you go. Yeah, they may recognize that, they may have a relationship with you as their pharmacist, but generally that we all do sort of the same thing. You and I know that that's not true. The variation of service level and different offerings from pharmacy to pharmacy can be vastly different. So I think that, if I were to start up right now or talk to somebody who's starting up, it's just to, kind of get that service mindset in place and be forward thinking about what that will look like down the road as the reimbursement evolves around that area.
Yeah. Yeah. So I love that this podcast every now and then makes its way to somebody who's not from the realm of pharmacy. And sometimes this could include lawmakers. This could include, who knows who stumbles across this podcast. So all of those things that you're talking about, those enhanced services, those things that pharmacies can do, is really something that CPESN has been working to strengthen. So can you real quickly kind of explain CPESN and the ideology behind that, just kind of the elevator pitch for anybody who's not familiar?
Yeah, you bet. So CPESN is the Community Pharmacy Enhanced Services Network. And the real idea here is that, not every pharmacy is the same, and that pharmacies like mine are providing these enhanced services or kind of above and beyond just the dispensing process to take better care of their patients. And we need a way to aggregate the pharmacies that are doing those kinds of services. And this network is the way that we do it, so that we can approach, insurance companies or employers to say, here's a group of pharmacies that can provide these services for your employees or patients or whoever it may be. And so that we can improve the quality of healthcare and lower the cost of healthcare by providing that locally within these community pharmacies.
Nice. So membership with CPESN kind of holds pharmacies accountable to you need to operate on a higher level. But you guys also kind of provide that support to help pharmacies advance their profession and move forward. So when you opened your pharmacy, were you right out of the bat offering those enhanced services? Were you involved with CPESN, or did that kind of come across later? Like, hey, we're open, but we can do more. Like, which kind of drove the other?
Yeah, so I think for us, when we open, I don't know if like MedSync was like as much of a buzz thing as it is now. Maybe it was, I don't know. But we just, from the get-go, we're kind of like, okay, we need to streamline things, make things easier for patients, make it easier for us when we're in the dispensing process to kind of understand what's going on with this patient. And MedSync is a great way for us to do that and review their whole profile at once and, see what we can do to help. So that was kind of our mindset when we opened. And, a lot of times people didn't realize, patients, obviously, most of the time we don't say like, we're going to put you on MedSync. It's not really how we approach it with them, but we would just do that kind of in the background to streamline things. And that became really beneficial. And then when people would come in, we would have, some payer opportunities with like MTM in the state of Ohio that we could then, in our workflow, do these additional services. So CPESN, I don't think was quite born yet in 2014. I think we're coming up on our 5 years here with CPESN. So I think what catalyzed things in Ohio, that was probably 2017, 2018, at a meeting, I think it was an Ohio Pharmacists Association meeting, talking about, had a lot of like-minded folks that were doing similar things. We knew about CPESN. Actually, Kevin Day was working at NCPA at the time, and was moving back to Ohio to buy his dad's store. So the two of us were like, okay, let's do this. And we had some other folks that were willing to jump on with us, and just kept kind of pushing things forward, and really created this community of pharmacies and we actually meet once a month with the CPESN Ohio pharmacies. And what's evolved out of that is a lot of best practice sharing, and has been a really nice community of folks to rely on and learn maybe what we can do different, what other services we can bring on that we haven't thought of. But CPESN has definitely driven us to, do more. And I think especially with the documentation piece and making sure that there's processes in place for the services that we're doing, so that, all the knowledge about my patients is not just in Alison's head, but that we have an actual process for the whole staff to be involved in the care of our patients. So I think that's definitely been a benefit of CPESN.
Nice. Yeah, it's super cool to see that you were kind of there from the beginning. And pharmacists love to talk. Pharmacists love to help each other. So it's cool to have that kind of standardized support network that you guys can work within, not only within Ohio, but it's 47 states now have CPESN networks?
Correct.
It's correct-ish. Yeah, you're right. That map has definitely changed a lot in the past even year, just seeing those new members. So it's really cool to see that collaboration. So you started with kind of MedSync, and I think you're so right, by the way. If you ask patients if they want to sign up for something, especially something with a lot of syllables like medication synchronization, the answer is going to be like, no. It's that we're so used to being upsold at the point of sale that, nobody wants to sign up for a program. But if you just say, hey, we can have all your medications ready for you at the same time, they're like, really? Awesome. Yeah, of course I want that. That's super cool. So you kind of started off with the medication synchronization. What was the next enhanced service that you kind of introduced into your pharmacy?
So I think the MTM program in Ohio, has been great. And I think that we were probably doing them both at the same time, but kind of having that aha moment of, oh, we can do this at the same time because I'm seeing this person every month to get all of their things. And, oh, why don't I check this other queue for MTMs? And if I can do whatever their CMR or their tip is at this moment, rather than taking, a couple hours or a day out of the week to go through my MTM queue. So that really helped us to accomplish a lot more with the time that we had, especially starting out, lean staff, lean in personnel, trying to get all the things done. So that really, I think, was the next sort of approach that we took.
Yeah, for sure. So kind of getting some of the basics underway with those. What was the next big push, or did you have kind of like a passion that you had found in pharmacy school, like, really, diabetic training or close family ties, something that you were passionate about that you really wanted to move on next?
So I think, again, like from the get-go, I shouldn't say it, mostly from the get-go, we were doing a fair number of immunizations, but then kind of having that, approach of, well, while I'm talking to you about this, we should talk about your immunizations and screening and making sure that we're getting you up to speed as far as where you need to be with all your immunizations. So, we were kind of always doing that. We got better at, approaching people on a more routine basis. We continue to get better as we have access to the registry and can kind of actually see what's going on and have more data about the patient and their immunizations. So that was probably the next focus area. And then during the time of CPESN, review of the opioid service set, we, as a Ohio group, said, this is something that's really important that we need to be doing. And that was kind of the next big focus for our pharmacy, was to making sure that we are doing a really good job of educating people when they were getting an opioid for anything, making sure that we had a solution in place to dispose of any extra medication, and then making sure that we got a protocol for Narcan so that we could dispense that to patients without a prescription, and educating them and family members what overdoses look like, and making that a process that happens routinely in our pharmacy.
So in Ohio, are there things that you guys can do specifically that maybe, your legislation has allowed you guys to kind of advance your profession? There's really a lot of variances between different states and opportunities for pharmacists to serve their patients. So what have you been able to find that you can do specifically in Ohio that you're really excited about?
Yeah, so that's a great question, and very much what we're looking forward to kind of diving into as our next thing. But provider status through the Department of Medicaid, allowing us to bill on the medical side for patient visits. So we're definitely looking forward to getting that started, hopefully in our pharmacy. I think one potential barrier, there's probably a couple barriers here, but the big one is probably collaborative practice agreements, getting those in place to be able to see the patients, then bill for them. That's a requirement within the state of Ohio that we have that collaborative practice in place. So I think as we kind of work through the next couple months of getting started with our Cohort 3 Flip the Pharmacy group, that's going to be very much our focus of getting pharmacies paid and looking at, this is an opportunity that any pharmacy in Ohio could potentially pursue, trying to figure out how do we implement that in a bite-sized way like we have with some of these other services, and drawing that out with, the support of the Ohio Pharmacists Association has done a tremendous amount of work on provider status. And, we have pharmacies in the network that are currently, working through that process. So relying on their expertise and those that, have been working on it from day one, and hopefully seeing a lot of growth in that area across Ohio community pharmacies.
Yeah, for sure. So do you think that like collaborative practice agreements there, I mean, have you guys had collaborative practice agreements in place to some degree before? Or like how limited is the scope of those collaborative practice agreements moving forward?
So we have never had one in place at our pharmacy. So, but typically it's like per patient, per provider. So it can be quite cumbersome. So, if we had a collaborative practice and you were my patient, I would need to have one specific for you with your provider. So you can imagine, as you work with a lot of providers and patients that see various providers, it could get kind of tricky, especially if we're working in the realm of one type of insurance, and pursuing that. We would need to figure out, with all the different MCOs that exist, managed care organizations in the state of Ohio, I think our approach is going to be figure out which MCO is the most popular in our area, get signed up as a provider with them, run a report of my patients, see what our overlapping physicians are, and then try to approach the one that we share the most patients with, or leveraging local relationships to get those CPA set up. So this is going to be a challenge, I think, but one we're up for, I guess.
In that small town setting where you only have a couple of providers, I can see where, this could be extremely beneficial, especially during like flu season. But what other services are you guys looking at with that collaborative practice agreement? Are you going to be looking for like annual wellness visits, or where's that heading?
So I think it'll be very much pharmacy dependent. So we've talked about it a little bit within our leadership group, and just how different our pharmacies are from location to location. And so I mentioned earlier that we have a resident who splits his time between my pharmacy and then also the Ohio Northern University pharmacy. And they actually have a mobile clinic that goes out to rural areas. And so we've been talking a lot about, what their landscape looks like versus our landscape, and their focus may end up being more like behavioral health or those sorts of things, where mine may just be, we focus on hypertension, diabetes, and hyperlipidemia to start. So, it really could vary based off of the population that you're working with. But I think for us at my pharmacy, we'll probably very much look at what kind of, baseline diabetes, hypertension, hyperlipidemia is what we're seeing most of the time. So it seems like a very logical place to start. And likely those are the patients that are, requiring more care, have a lot of comorbidities that, hopefully we can assist and, give those providers some more time, because they're very busy too, and free them up a little bit to do some other things.
Yeah, and a lot of those are such like leading indicators of the really expensive problems in healthcare that, that general practitioner may see the patient once or twice a year, when really is a lot of those things, that monthly coaching with that appointment-based model is what's really going to have such a strong impact. It just makes sense that, that healthcare professional with that monthly touch point, that close communication and relationship is really positioned to have the most benefit.
Yeah. And to your point, I think that, going forward, kind of one of the next things I'd like to look at is chronic care management and annual wellness reviews, and kind of looking in the Medicare space a little bit more to grow beyond that initial, and who knows what will happen with what we're legislated to be able to do. But for starting with the Medicaid population in Ohio and see where we can grow from there.
That's so cool. So, that's definitely, so something I talked about a little bit the other week with Cody Clifton was, this is a lot for a pharmacy who's already doing a lot to try to keep up with, try to stay on the cutting edge. And so to have that continuing education kind of structure that you've built with CPESN and Flip the Pharmacy, that seems, if you want to practice at the top of your license, like it's really necessary to have that kind of that infrastructure.
Absolutely.
So tell me a little bit about Flip the Pharmacy and what you guys are kind of diving into. We're starting cohort 3 at this point. So tell me a little bit about what you've done and where you're headed.
So I do help to lead the Flip the Pharmacy efforts in Ohio, and I also coach pharmacies as well as our pharmacy participated in cohort 1. So we're kind of wrapping up with the formal program, but we'll continue on and stay engaged, because I think, that is something that's really important to keep pushing us and having accountability measures, because that's one of the, I think, best things that Flip the Pharmacy has brought. It's this bite-sized chunk each month of like, here's what you should be doing to kind of elevate yourself to the next level. And without that sort of putting a deadline on it and having some sort of like hyper focus for the month, it's really easy to just say, yeah, well, we're doing a lot of other stuff and we're just too busy for these other things right now. And, COVID's changed that to some degree, that it's kind of reshaped how we're doing things a little bit. But that being said, we put 10 pharmacies through that first cohort. The second was, I think, about 25, 26 pharmacies. And we had some from bordering states, an Indiana pharmacy, a couple Michigan pharmacies. So that was cool to collaborate with CPESN Michigan. And then those pharmacies from cohort 2, we're going to mesh with our new cohort 3 group and have about, 60 pharmacies going through together. And we're going to try and do a little bit of a reset for the cohort 2 folks, because most of their Flip the Pharmacy experience thus far has been COVID related. And, that has caused us to really evolve quickly in the pharmacy. So, good or bad, we've learned a lot and have really focused on that appointment-based model and figured out how to do all these immunizations and testing and different things. So we've done a lot as far as practice transformation, but we'd like to get back to, some of the chronic care management things that we were initially focused on. And honestly, pre-COVID, when we went through the hypertension progression, that was just a really cool experience for our pharmacy, because, we're used to filling a blood pressure medication. Maybe you get a chance to talk to the patient about what their blood pressure is and how things are going. But to say, for the next month, we're going to be focused on capturing these blood pressure readings from patients and really purposefully having those conversations, recording lab values, and then revisiting that each month, or sooner if they weren't at goal. We got to a point where we had a lot of patients that, they'd walk up to pick up their prescriptions and they'd rattle off their latest blood pressure to me. Like, I checked it this morning. Here's what it was, because they knew we were going to ask.
Nice.
So it kind of pushed them to be more cognizant of their monitoring. And then people that weren't at goal, we were taking a ton of blood pressures in the pharmacy, and we had people that were just stop in, every couple of days or daily to get their blood pressure checked, because they wanted to make sure that we did get them to goal, and then reaching out to physicians with those readings and having them say, yeah, absolutely, we should change that medication. That's accepting our recommendations. So we just were, from a, provider satisfaction standpoint, it was very rewarding. And then also for the patients, I think they were glad to say, well, somebody's watching out for me and we can get this done. And not that we don't want them to go to the doctor, but if it's something that we could get done without them having to have a separate appointment, and then they still, are following up in, 3 months or whatever the next appointment time was, but we don't necessarily need to wait till their 3-month appointment to get their blood pressure a goal. So that was a cool thing, I think, for everybody. And hoping to kind of get back there as hopefully we get some more normalcy in the coming months.
Yeah, hopefully. That's got to change the psychology of, any kind of health concerns for a patient too, because, I'm just thinking about my father. He lived in New Orleans, and he loved the food in New Orleans, and I remember him telling me that he had a doctor's visit coming up, and he was not looking forward to it because he knew he was going to be in trouble, right? But it was this thing in the future that it was like, yeah, I got to worry about it then, and then I'm going to get in trouble, and then I'm probably going to eat better for a week afterwards. But then I've got, 6 or 12 months until I have to go be held accountable again. So being able to have like that personal goal where you can go in, and it's like working with a personal trainer almost, where you have that accountability and you're like, yes, I see progress, I'm moving forward. It's a much different approach, that proactive engagement instead of just, it turns out nothing's changed and that didn't change anything. Imagine that. So,
yeah.
So you're working with the, continuing education with Flip the Pharmacy. Do you find that having the students in your pharmacy often kind of helps drive that energy and keep that kind of like, keep you from getting comfortable where you're at?
Yeah, it's great. We love having students. I wish I could have a student all the time because they always just bring a fresh perspective into the pharmacy. And, everybody has a little bit of a different, background and where they've worked and what their experience has been thus far. So it's nice when we can kind of show them what we feel like community pharmacy should be. But they always have tons of questions and ideas and like, why would you do it this way? What have you ever thought of this? And, streamline our processes and just keeps us on our toes and are just super willing to jump into whatever we have going on for the month with the pharmacy and help to drive that, because if you can kind of task the student with, we need to do X number of care plans and we're focused on blood pressures this month, they're going to be the champion to kind of get things going in your pharmacy that month because they have some ownership of it. And that's been really great for us. And our patients love interacting with the students. And, like I said, I wish I could have a student every month.
Yeah. How long is the rotation when you have those students there?
So we typically take Ohio Northern University students and their rotations are 1 month long. So they're there for the calendar month.
So I was looking at your Facebook page for the pharmacy and I thought that was so cool because especially in a small community, you could see a new face there and it could be kind of one of two things like, oh, okay, that's one of the temp people and they're going to come and go. But you've kind of celebrated, hey, here's this new person starting their journey into pharmacy. We're happy to have them. So I saw on your Facebook, you had, looks like Rochelle, Luke, Kaylee, Connor. You had these smiling faces kind of highlighted on your pharmacy page, which I think is so cool because it's really kind of put them in the spotlight in your small community. So, when your patients come in, I feel like there's already some of that connection that community pharmacists love, and that's kind of what keeps them in the community pharmacy game at the end of the day.
Absolutely, yeah, and we love having them feel welcome, and really appreciate our patients making them feel so welcome.
Yeah, that's pretty cool. I love the kind of dichotomy of the precepting and then also, that continuing education with the flipped pharmacy and the CPESN, I think is just so important. So what's next on the horizon for pharmacy in Ohio? I know COVID was a big disruption in the industry and, disruption a lot of times is, causes change and breeds a lot of new ideas. I saw you were early to adapt to the COVID testing, early to adapt to offering immunizations. So what have all those changes that COVID brought kind of contributed to your pharmacy, and how does that carry into 2022?
That's a good question. I think we're bracing ourselves right now for flu and booster season and open enrollment all to happen at once.
Yeah.
trying to get ready for that. I think really trying to work on that appointment-based model, MedSync, helps. And for the testing, there's just no way we could have done it without that. And as far as the vaccines go and boosters, I wish we could do more. Our community was great. We did drive-through clinics at our fire department, and we had like various community members volunteer, and just super cool. Like our chief of police was there, helping out for various clinics, and just lots of people willing to do their part when they didn't have to. So I'd love to see that kind of like flu season. Let's do our drive-through clinic at the fire department again and make sure we get everybody vaccinated. Whether or not that will be a reality, I'm not sure about that. Not for the fact that everybody wouldn't be willing to do it, but I'm not sure if, the patient mindset has quite changed to wanting to do that. We still definitely have a convenience care marketplace. And so that's one of the challenges that we face, and trying to find that balance as we push into this, service-based care delivery. So my hope is that we can continue to evolve and possibly bring on some, maybe flu and strep testing now that we, feel confident that we can do testing in the pharmacy. We figured it out. So what does that look like down the road as we kind of enter into flu season? I think that's one of our next questions, and just trying to balance, like we added all these services quickly, and trying to make sure that everything is sustainable and we're able to carry them forward.
Yeah, I really hope that's one area that pharmacies have been able to demonstrate that, hey, this is a no-brainer. Like, we should be doing point of care flu testing and have that collaborative practice agreement for Tamiflu. And, that just makes so much sense. I think, in states that have some of that groundwork already in place, it just seems like the logical push, hopefully, if not 2021, the 2022 flu season.
Definitely, yeah.
What's next for the Jackson Center Pharmacy? Are you planning on expanding into other communities? Are you going to go multi-store, or are you planning on spending more time in the pharmacy or more time consulting? I'm always curious to see what the once we're in the new normal, what's exciting for you.
Yeah, so I think the next big thing we have on our plate is we are actually going to move the pharmacy next door. So that's been kind of on the docket here for a little while. So getting ready to pull the trigger on that. I'm actually in the new pharmacy space, if you will, right now. So we've put the plans together. That's our next big thing. Long term, definitely open to the idea of more stores and, figuring out how we can be in more of these small communities. But no immediate plans there. But yeah, definitely, I think as far as next steps for me personally, I'll always be in the pharmacy. But I do love the consulting and working with other pharmacies and just learning from other people in the industry and kind of continuing to push my own, knowledge base and build out these networks of, awesome folks that are doing great things across the country. So that's definitely a passion for me and bringing back what I learned to my pharmacy.
Perfect. So if you are an independent pharmacy out there and, you're doing pretty well. You're kind of, you're profitable. You're leaving every day with a smile. Is CPESN going to help that pharmacy? And what if you're a pharmacy that's saying, man, I really don't have time to do anything else right now because I'm struggling. I'm just trying to, keep this pharmacy going. Is CPESN going to be beneficial to a pharmacy that's kind of in that boat?
Yeah, so I think either way, I mean, the dispensing revenue, is just, we watch it go down every year. So I think if you're wanting to be sustainable for the future, it's really important that you advance what you're doing and take a look at these enhanced services and how that you can either fit them into your workflow, because we're all struggling with wearing a lot of hats and, have a lot going on, especially right now. So it's just really important to, figure out a way to make it work in your pharmacy. And I think there's lots of ways that can be done. And I think any CPESN pharmacy is willing to help you and tell you what they've done to make it work at their pharmacies, but the leadership team especially, and we've worked on projects with both our resident and students to go into pharmacies and help them get started with care planning and what that looks like and, just baby steps. So I think having the mindset that, you're not going to overnight CPESN isn't going to flip your pharmacy on its head. It's all about, just taking the next step to keep your pharmacy relevant and sustainable for the future. So, I think that it's a good fit for anybody that's willing to go that extra mile for their patients and is looking to get reimbursed for the service side of things.
Yeah, for sure. It's one of those things, everyone goes to trade shows and they get their trade show book and they have their notebook and they're taking notes and they have all these great ideas. And when you get back to the pharmacy, you still have a queue, you still have the phone ringing, you still have all those things that need to be done. So it seems like that's a great way to carry that excitement through with some accountability and that monthly march. Instead of just a goal that one day we'll do that thing I saw at the trade show.
Yeah, just one day at a time, one new thing at a time, because otherwise, it's just not realistic. So that's really how we have taken the approach, at our store is that, we know we can't, bite off more than one bite at a time. So.
Yeah. And so when you hit that first roadblock, instead of, putting the project aside, you say, I'm going to reach out to my luminary and, Allison's going to help me get this figured out. So
yes, there's a whole community of pharmacies that have been there.
Awesome. I'm going to let you get back to work. Thanks so much for joining. See you soon.
Thanks.
Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.